I asked over 100 medical professionals to give me their tips on movement as it relates to their medical specialty. This video might change your life.
Hey Dr. Brent, I'm Jake. I'm a dermatology PA, former trauma surgery PA, and I'm here to talk a little bit about how movement affects health. And I think we all know moving your body not only helps boost your mood, it keeps your body strong, it helps your heart, but figuring out a way, and my advice would be, incorporate it into a daily routine. For instance, when I was in trauma, I was working, my office was on the 6th floor, I was seeing consults in the ED on the 1st floor. I made it a point to take the stairs and not the elevator. But go at your own pace, listen to your own body, every little bit counts, but incorporating something, whether it's walking or stretching, dancing, into your daily routine will help move and will help health.
Hello, my name is Dr. Jackie Dieg. I'm a chiropractor in Peoria, Illinois. And I want to talk to you guys about movement today. We've all heard it, movement is medicine, but it truly, truly is. If you want to keep your joints feeling young, you cannot be sedentary. So one piece of advice I have for you is find an exercise or movement routine that works for you. It doesn't always have to be high intensity workouts and running. It could be yoga, swimming, walking. It's always great to do resistance training, but as long as you keep moving, that's half the battle. So that's my number one tip, is just find what your body likes and keep moving.
Hey guys, Joe Piersanti, physical therapist here. Had the question of basically why is movement important? Well, as a physical therapist, you know, that's what we treat. That's what we work on, is getting you back to your movement, whatever you want to do to get back to healthy and whatnot. But I think that movement is very important for longevity. You know, as you age, you have kids, whatever, you want to keep up with them. You have to be able to move to continue to do the normal things that you want to do, right? And if I were to recommend one tip to you right now, it would be stop making excuses. Start right now. Whatever it is right now that you're like, you know what, I don't want to start doing CrossFit because I'm not fit enough. I gotta go to a normal gym first. It's not true. Stop making excuses. Just whatever you gotta do right now to get after it, just go do it. That would be my tip.
Hi, I'm Dr. Jason Hammond, co-founder of the Wellness Connection outside of St. Louis, Missouri. My specialty is chiropractic and functional movement or functional exercise. I've been in practice for over 22 years, and one of the biggest things I stress to patients on a regular basis is motion is life. We have to keep moving throughout the course of our day. We have to keep moving to keep our bodies vibrant and healthy. And all too often, people aren't moving enough through the course of their day. So I advocate a certain tip. I call it movement snacks. So the course of the day, taking small breaks in which they move the body, the full body, full squats or air squats, push-ups, doing some type of band work. But through the course of the day, taking micro breaks and having a movement snack. So again, hopefully that helps some of you out there. And remember how important motion is. Motion is life. We got to keep moving. Movement is medicine.
Hi, I'm Megan. I'm an occupational therapist, also known as the Golden OT on Instagram and TikTok. In OT, movement is used as a key therapeutic tool to improve an individual's ability to perform meaningful daily tasks by addressing those underlying motor skills, enhancing coordination, and facilitating participation in their desired occupations. Whether that be fine motor skills for cooking, dressing, writing, or even gross motor skills for playing sports, taking care of a child, walking your dog, or even simply balance and mobility for everyday tasks. Everything we do in our daily lives involves and requires movement, which is why OT incorporates movement into therapy.
Hey Dr. Brent, thank you so much for having me. My name is Ryan and I'm an account executive at the Pro Adjuster Group. I believe that movement and health is very important to incorporate in everyone's daily lives, especially to improve cardiovascular health. Movement not only improves one's health internally, but it also has a significant positive impact on one's mental health. Studies have actually shown that those who stay moving think more clearly, sleep better, and are less stressed. This actually ties into chiropractic care because our goal is to get your joints moving and keep them mobile. This can be hard to incorporate into one's daily life because most of us have obligations that keep us from moving. However, if we carve out at least 10 minutes every day to focus on some sort of movement or stretching, it will have a positive impact on our lives.
This video might change your life.
Hey everyone, I'm Dr. Aaron King and I'm a chiropractor. The best advice I could give you regarding movement and health is simple. Motion is life. The more you move, the better your body functions. One key tip is to prioritize spinal mobility. Try taking short movement breaks throughout the day, stand up if you're sitting too long, stretch, and do gentle spinal rotations. Small movements lead to big improvements in how you feel. So keep moving, stay strong, and take care of your body.
Hey everybody, and hey Dr. Brent, thanks for having me. My name is Dr. Tricia Starkey. I am a physical therapist, a professor at Bradley University. I'm a board certified clinical orthopedic specialist and a pelvic floor PT. And if I had to give one piece of advice for everybody, it would definitely be to learn how to strength train or weight train. And there's two main reasons I say that. Number one is that strong, healthy people are not getting injured at the same rate that those who are weak are. They're not having aches and pains and chronic issues. And if they are, they're bouncing back a lot more quickly. And number two, strength training is extremely empowering. So man or woman, young or old, everybody can do some form of strength training. And it's empowering physically, but also mentally. So physically, there's a reason weight loss programs start off with strength training. You tend to see benefits a lot more quickly, which helps people stay more consistent. You can get cardiovascular benefits. Having greater strength allows you to feel more functional and independent in life. And then also mentally, it is extremely empowering knowing that you can do what you need to do during your life or during day-to-day tasks, things that were unexpected, whatever. And so this is extremely actionable right now, just in the comfort of your own home. So learning 2 or 3 things that you can do, even just body weight exercises that you can do at home, is a great way to get started. Thanks for having me.
What's going on, Dr. Brent? Thanks for having me. I'm Dr. Ryan Bilecki, owner and chiropractor in Downers Grove, Illinois, here at Spineco Chiropractic. What is my best advice for patients regarding movement and health? Honestly, the number one bit of advice that I give all of my patients is finding 15 minutes per day to stretch your body. You can split it up. You can do 15 minutes one day upper body. You can do 15 minutes the next day lower body. Everyone always says they have difficulty finding time to put this into their schedule. I always ask them, do you watch Netflix at the end of the day? Do you watch TV at the end of the day? Find 15 minutes during your show or during your episode or during your movie, whatever it is, and incorporate your stretching while you watch. This way you can integrate it into your day and you don't always have to find time for it. The time's always there, you just have to make it.
Hi, Dr. Brent. Thanks so much for having me. My name is Dr. Katie Matuli. I'm a primary care physician. In primary care, our first focus really is on preventive medicine, which means lifestyle interventions to help prevent adverse health outcomes later down the road. And I really love the term movement is medicine because I truly do believe that exercise and keeping your body active has the ability both to help prevent and treat chronic disease and really improve quality of life for our patients. And it's so hard for so many of us to feel like we're getting the proper exercise, whether that's due to time, energy levels, or resources. But my advice to my patients is to get creative, whether that means looking up short YouTube workout videos, taking your dog on a walk, splitting up your exercise into 10-minute increments throughout the day. It's all about finding something that's realistic for you, your lifestyle, and your body, and that you can fit into your daily routine. Thanks.
What's up, Dr. Brent? Thank you so much for having me. My name is Matt Shear, and I'm an athletic trainer at a Division III university. My biggest advice for my patients when they come into this clinic complaining of an injury or they're just trying to get better is that there is no bad positions, there's just weak ones. So in positions where there might be pain, maybe it's because we're not strong enough in there, so I try and find that range of motion that they're able to comfortably move in, and then we try and maximize that and strengthen that position, and hopefully we get more ranges of motion out of that. I think that just works throughout your entire life so that you can build resiliency in your everyday activities and not just out on the field. So remember, there are no bad positions, there's only weak ones. Get strong.
Hello, my name is Jonathan Richardson. I'm an occupational therapist in the state of Tennessee. Thank you, Dr. Brent, for having me. I'm excited to share what I know about how we can change people's lives. As an occupational therapist, we seek to give people the tools through adaptations, compensations, and modifications to daily life, environment, or activities so that people can be as independent as possible in their daily routines, habits, or rituals throughout the lifespan, regardless of whatever they're going through. Now, as someone who works with a geriatric population at a skilled nursing facility, I can say that movement throughout the day is as vitally important as a well thought out exercise regimen. Studies are actually showing that that can be as effective, if not more effective, for different people in mitigating the decline that happens throughout the regular aging process and different diseases, neurologically or musculoskeletal, anything of the above. So move throughout your day, because what you don't use, you will lose.
Hey, thanks Dr. Rassi for this opportunity. My name's Dr. Matthew Schmidt. I'm a chiropractor in Morton, Illinois, starting my 28th year of practice at Heartland Chiropractic of Morton. When it comes to explaining motion or movement in health, the biggest thing I try and explain to patients is motion equals life. Things that keep moving last longer. Things that stop moving start to deteriorate and decay at an accelerated rate. So whatever it is that you enjoy doing, keep doing it. Golf, tennis, walks, riding a bike, running, anything that keeps you moving. The other thing that's extremely important is regular chiropractic visits, because our joints need to stay moving as well.
Hi everybody, my name is Dr. Ben Dieg, and I'm really excited to be part of this Movement is Medicine series. So, our tagline at my clinic is to help people feel better, move better, and live a better quality of life. So we're really big on that movement side of things. Now, I like to remind people, think about what your goals are. Everyone's approach needs to be a little bit different, but in essence, if you're talking about how to move and feel and function at your best, you need to do at least all three planes of movement. So where you bend your body forward and backwards, side to side, and rotationally. Doesn't have to be anything complicated. The more you sit down, the more you need to invest in doing the opposite movements of that. So if you're a sedentary desk worker, get up and move around at least every hour. Get up and walk around for at least a minute.